We went through a very challenging time. We closed the zoo the first time for the length of period in our entire history, 124-year history.
I lost my father to suicide in 2000. He had not exhibited any signs of depression that I was aware of. His suicide was a complete shock to all of us and really pulled the rug out from underneath me.
The unknowns of the pandemic and COVID and the changing world around us created a lot of anxiety, a lot of challenges for our staff. The Depression Center was there for us.
The first time I did a suicide prevention training, I realized if I had just had this information, if I had had this language, if I had known what to do, how to respond, that the outcome maybe could have been different.
This time to ask for help is so critical. The Helen and Arthur E. Johnson Depression Center is that resource in our community now more than ever that is needed while so many Americans are dealing with clinical signs of depression and challenges of life right now.
The Helen and Arthur E. Johnson Depression Center. First and foremost, we are an outpatient mental health clinic. We have psychiatrists, we have psychologists, we have clinical social workers. We run the gamut of what services you're able to get, from medication management to therapy to both to team-based care, family-based care, all under one roof. The Johnson Depression Center serves people at all stages of their life.
It's extremely unique, it's innovative, and the team that I work with are some of the best that I've ever met.
In addition to that, there's lots of research going on. It's affiliated with the CU Anschutz Medical School. And the part that I really like is the community programs.
Our community-focused approach is unique. If you look at the data, some people can go 10 years or more from their first symptom onset to actually getting services. It's okay not to be okay. We're really trying to get people to truly understand that and seek out services before they become chronic.
We provide education and programming for a range of organizations and individuals who are seeking more awareness and understanding around mental health. So we go into schools, into nonprofits, into businesses. We talk about stress management and self-care. We also have programs that focus on anxiety or depression or suicide prevention.
I specifically got involved with some of the suicide prevention training because that's near and dear to me. Every time I have hosted a suicide prevention training, I get 1, sometimes 4 or 5 phone calls about someone that was able to utilize that information and truly save someone's life.
What's really unique about our community programs is that they are free to the public. They are funded through philanthropy. So we do have this opportunity to reach a variety of organizations and schools and individuals who may not be able to get that education elsewhere.
Almost 100 of our staff took place in these workshops, and the exceptional experience that they had through that training helped them get through this really, really difficult time.
COVID has definitely impacted people's mental wellness, their mental health. We have seen a significant increase in the number of people reaching out for services.
Thankfully, we have telehealth pivoted very quickly to using that. The barrier to access has been lowered, which is normally a tremendous issue.
An interesting thing with telehealth is it's reduced our no-show rates. We have really led national efforts in broad-based telehealth services. The guidelines that people are using and the best practices, a lot of that work was actually developed here through faculty at the Johnson Depression Center.
Even through our community programs, we've been able to do outreach through COVID where we are doing all virtual. I had never done anything virtual before, and now we've had this massive increase in interest. We have had such a great impact, not only in Colorado, but nationwide as well.
Our ability to utilize donations to provide education to a new community, to develop a new training that we haven't done before, to provide services for people who can't afford care. Every donation that we get simply goes back to providing services, to providing care.
We care about our employees deeply. We want to make sure that everyone's good. And then we want to make sure they're good not only for themselves and their families, but for the millions of people that experience the zoo.
The future holds a lot for the Johnson Depression Center. We're going under the Department of Psychiatry, which is going to really increase the levels of partnership that we have, our ability to connect more just across systems. I think that'll be significant for us.
These partnerships are really vital because they help further destigmatize, which is one of our primary missions, but they also allow the center to reach more people.
We are just on the tipping point of what we're able to do, and there's so much more. We really have this ability to have such a greater reach and cast such a wider net.
The work we do would not at all be possible without our donor community and people continuing to reach out to us and say, I've got an idea. There's something I'd like to do. There's an impact I want to make.
Having an organization like the Helen and Arthur E. Johnson CU Depression Center working together to help our community is so special. It's so meaningful. It makes such a difference.